And now to some health matters. The migration of Nigerian doctors to other parts and other health workers to other countries in the world has taken a toll on hospitals across Nigeria as the institutions have reduced the number of their outpatients and surgeries due to a shortage of manpower. Investigations have shown almost all the health institutions are battling with the shortage as they cannot cope with the high number of patients who have thronged the government hospitals, which were in the past affordable compared to the private ones. Well, last week, Chairman of the Nigerian House of Representatives Committee on Health raised the alarm that not less than 5 wards with about 150 beds had been closed down at the Lagos University Teaching Hospital in Diaraba due to a shortage of health workers. The wards had to be shut because there were no workers to operate them, despite the large number of patients were received at the institutions on a daily basis. Well, Dr. Lilian Nwaobasi is the president of the Medical Women's Association of Nigeria, Ebonyi State chapter. She joins me further to discuss this. Thank you very much for your time, Dr. Nwaobasi. Now, you're a medical doctor practicing in Nigeria. How do you describe the impact of the migration of doctors and health workers in the Nigerian healthcare system to other countries? Dr. Nwaobasi, we cannot hear you. You might have to unmute your Zoom.
Can you hear me better?
Yes, very well, thank you. Please go, Dr. Nwaobasi.
Okay, so the impact of this migration, popularly known as JAPA in the streets, is a lot on the Nigerian healthcare delivery system. Every day we're losing about 700 doctors to migration outside Nigeria on a yearly basis in Nigeria. The figures might actually be bigger than this. And what are its impacts on the healthcare delivery system? When patients come into the hospital, there's a reduced number of doctors. That means the projected doctor to patient ratio load is increased. So a doctor that would have seen 100 is forced to see 200-300. Not just doctors, nurses are moving. So there's an increased patient wait time because there's less people to work. So the number of patients that come, they have to wait more before they get to have access to a doctor. And then there's an increased toll on the system because the more doctors are working, the more greater impact they have on their health. Some of them tend to break down. They have fatigue, and then this means that they're unable to give their best in the healthcare delivery to their patients.
What are some of the main reasons that contribute to the shortage of manpower in Nigerian hospitals?
Okay, there are a lot of reasons why people migrate outside Nigeria or the JAPA syndrome. But what seems to be top on the list is the remuneration that doctors get. For example, when you check what someone has to go home with at the end of the month, it is a very serious push factor for most doctors. This point remuneration will make people be in a hurry to leave the country because they have hope that they will be paid more and they'll have access to more funds when they leave the country. Then number two, there's this increased sense of insecurity around town. And I had one of my teachers would tell you that in a village meeting, that the son of the king is at risk. When compared to some other civil servants, a doctor is presumed to be paid slightly better than others. Okay, so like I said, the top on our list, the main push for JAPA most times is poor remuneration. What people have to go home with at the end of the month, at the end of each working month, is almost not enough to solve most of the problems they have as families and both nuclear and extended family system. Then I talked about number two, there's an increase in rising insecurity in the village meeting, that the son of the king is a soft target. Okay, compared to other civil servants in Nigeria, doctors seem to be slightly better paid, and that makes them a soft target. So it's easy that kidnappers and other forms of insecurity social vices make doctors a soft target. So this rising insecurity is also a source of worry and a serious push for the JAPA syndrome. Then we talked about poor work condition. When you come to work and you do not have the basic facilities you need, maybe to make diagnosis, you're watching a patient helplessly, It's a serious push when you see a better workplace to go and where you're able to better help your patient. So poor work conditions is another push. Then another push is also family ties. With the increase in migration of doctors and their family members, sometimes you might find out that you're the only member of your family that's still back in Nigeria. Trying to reconnect back to your family is also another push that also aids the JAPA syndrome that we're talking about. And then we've talked about poor remuneration, rising insecurity, poor work condition, and family ties. These are top on the list of the possible things that can make someone, doctors especially, to migrate from the country. Thank you, sir.
Right, I was going to ask you, about how to navigate them, but, I'm sure obviously if it's poor remuneration, then they have to do the opposite, which is to pay the doctors well.
Hello, I can't hear you, sir.
All right, I'm afraid we have to leave it at that. Dr. Lilian Nwaobasi, thank you so very kindly for sharing the experience of Nigerian doctors who are leaving the country in their droves, forcing now, as we've heard in that report.